Internet survey Karamis on public attitudes to sexual and reproductive health, abuse, violence and discrimination related to HIV and homophobia polled 773 people in Belize in November 2013. While the findings released today show positive attitudes, there are also areas of concern.
Number one, I would say is, compared to the other countries in the Caribbean that we've seen, with the exception of Suriname, Belizeans are more accepting than a lot of the other countries. And there's something very interesting and important, I think, that has happened in Belize, where we see that 34% say they would accept someone who is gay or homosexual. That is 3 out of every 10 people. That is 1 out of every 3. That is quite significant and actually a very good sign of progress in a Belizean society. And when we look at the information that we have on domestic violence, on the other hand, we ask people, have you seen or been a victim of, and a friend or family member of domestic violence? And 55% are saying yes, they know of a case of domestic violence. That's a high percentage in terms of domestic violence, and that indicates that there needs to be serious work done to prevent domestic violence, but also serious work that needs to be done to ensure that the perpetrators of domestic violence face the full brunt of the law. And I think it also indicates that some changes need to be made in how we do confidentiality in healthcare settings so that people who are HIV positive are identified and can get treatment, but just basically that people come in for testing, because people are concerned that, let me put it in a nice language, their business will be in the street if they come into facilities because there isn't confidentiality.
The results of the survey also showed that over 80% of the respondents have done an HIV test. Around 10% have tested positive. And as was revealed, majority of the men are less likely to take a test and seek medical services. The Ministry of Health says that this is a challenge that they're trying to address.
I think what we need to do, and I think the strategy that we've been trying to do for the last 3 years, is simply trying to engage more men to come in and get tested and seek services. Because as you rightly said, there's only 33% that have a viral load that's practically undetectable. But that's in general, men in Belize don't have health-seeking behaviors. So that, again, that's a component that's very weak for us. But what we have done is moved away from traditional VCT sites only, where in some facilities men are being offered HIV testing more routinely. That's one. And two, perhaps where our strategy has changed is, for example, we are gearing up for regional testing day at the end of June, is going out to entities where you have most of men working, for example. So in June, for example, we're going to be going to all facilities, major facilities or work companies here in Belize City, particularly where you have most of the men working, BWS, the bigger companies, and targeting men. We are not, if you notice, we are not targeting men having sex with men. We're trying to simply engage men into seeking more prevention, reducing risk, prevention strategies. That is where we are going.
Dr. Ernest Masaya says to adequately address the areas of concern highlighted in the survey requires a collaborative efforts of all partners involved.
Number one, the issues that we cover in the survey are difficult social issues. The first thing that needs to happen is we need to have much more of a national dialogue on these issues, because there are different views. What we have in the poll are the views from the population, but there are segments of the population that have different views. All views need to be heard, and based on an analysis of the facts and the reality, there needs to be a discussion with all parties about the issues, and on the basis of that, then what are the policy decisions that need to go forward. But what the poll does is it provides a basis, a central point, to discuss very difficult and thorny social issues that are affecting the population.
And to have that conversation would require accepting some of the realities, like 1 in 5 babies is born to a teen mother in Belize. And perhaps that is why respondents believe that pregnancy prevention and sex education should be taught in high schools.
The vast amount of persons saying that there should be comprehensive sexuality education at the secondary school level, and that's been a weak area for us. And that's a prevention strategy. Perhaps more striking for us is a vast amount of persons that were sampled said that it will be okay for condoms to be made available at a secondary school level. Of course, that's data that's just coming out for us. I guess for us as a Ministry of Health is how do you engage that particular data that's there with prevention strategies at the secondary school level to ensure that it's not only giving somebody a condom, but all the other prevention activities that you can do with that. And it's not only for HIV, it's for the other sexually transmitted infections, because I think what we tend to do is shy away from discussing sex, period, but we know that there's a lot of sex happening at the secondary school level.
Reporting for News 5, I'm Andrea.